I'd like to begin by thanking Sean, who delivered his presentation yesterday afternoon, where he talked about pragmatism in scientific research. So I'd like to thank Sean for introducing the word pragmatism, and I've used the word pragmatic here from the philosophy of William James, who talked about pragmatic approaches to scientific investigation into psychic phenomena. And my interpretation of William James's take on pragmatism is a simple question. Does it have usefulness? Does it work? Did it make a difference? Yes or no? And what I want to do this morning is to introduce you to a method that I use that I think is pragmatic because I know that it works. And I'd like to share that with you. I'm just going to give a few slides to give an introduction to a video recording that was made recently on my visit to the United States. Now, the scientific research protocol with a method of investigating auditory hallucinations that were acted upon by serious criminals was originally presented at a conference held at Bangor University in 2008, and that paper still remains unpublished. The hypothesis is that there's a difference between an auditory hallucination, which is imagined, and a veridical voice that originates from an external source, for example from a discarnate spirit. Since that presentation in 2008, my book has been published, and a more detailed scientific protocol, for those of you who have a copy of the book, is in chapter 15. It's a detailed scientific protocol on this very topic. Now, in order to test the hypothesis, remote spirit release practitioner teams are, at this present moment in time, being evaluated for their reliability, and a pilot experiment is in progress to test their efficacy in treating subjects who hear voices. Recordings of sample cases have been posted on YouTube. These cases are confidential and not yet available for public viewing, but can be accessed by anyone who asks me, anyone who's a bona fide researcher, just ask me for the link and I'll email it to you and you can view them. As I say, they're not yet for public viewing. Two very recent cases are specific to this hypothesis, the hypothesis that spirits can influence people into committing serious crimes. Two very recent cases I worked on in Michigan recently, and one of them I'll present to you here today. So, for research of this kind, what are the prospective sample groups? People hear voices, people who are disturbed by voices that cause them distress. And these are primarily the sorts of cases that I and my colleagues work with. Moving up the scale a bit, people who are diagnosed with schizophrenia, who hear voices and have been confined under the Mental Health Act. The prognosis for these people is not good. They tend to be on antipsychotic medication for the rest of their lives and stay trapped within the healthcare system. Moving up the scale again, serial rapists who've been imprisoned and who claim to hear voices, paedophiles, and spontaneous mass killers who've been imprisoned for mass murder and who claim to be motivated by command hallucinations. Now, I just want to show you some statistics on this, and I'm going to quickly skip through the first couple of pages because I want you to get an idea of the big picture. Since 2006, there have been more than 200 mass killings in the United States. I'm just going to skip through these quite quickly. Mass killings happen about every 2 weeks. Now this is the big picture I want you to see. And this was new to me. I only just discovered this whilst I was looking for some statistics for this presentation. Now, these dots represent mass killings, and a mass killing is defined as being the killing of 4 people or more. And the bigger the spot, the more people were killed. This large spot here, look, victims 49. This big spot up here, victims 32. Now, when you can see, we're right up to date here. That last one was reported August the 23rd. Now, I visited Michigan arrived in Michigan on the 8th of May. And what was brought to my attention was this case here. A 45-year-old taxi driver killed 6 people. And the people I was working with said to me, do you think we'd be able to investigate this case to see what motivated these killings? And I said, well, it would be an interesting exercise, wouldn't it? To see how we work and how effective it can be. So that's what we did. Mass killers who hear voices and act upon them. What proportion of mass killers hear command hallucinations? The question is, are these perpetrators just simply evil people? And of course, terrorists, people who act on political motivation, would be in their own category, wouldn't they? But my question is, are these people evil people? Are they mentally ill, not responsible for their actions? Or is there a third possibility? Are they possessed or influenced by an external source that is veridical and identifiable? And this is the key here, this is the crux. How do we tell the difference between an hallucination and a voice from a spirit? How can scientific research answer these questions? And these are the questions that I present to you today. How do people research command hallucinations? Dr. Helen Morrison is a forensic psychiatrist, and she wrote a book entitled My Life Among the Serial Killers. Over a period of 30 years, she interviewed more than 80 serial killers, including our own in the UK, Dennis Nielsen and Peter Sutcliffe and so on. Incidentally, I was in the army with Dennis Nielsen. He was our butcher. True. In Germany, 1965, he was our butcher in Germany. But I digress. So forensic psychiatry is the only means, the only scientific means by which the motivations of serial killers are investigated. And Helen Morrison, I'm just going to refer to my notes here because there are one or two little items that I don't want to forget to share with you. So, forensic psychiatry is the only method currently being used to investigate the motivation for the acts of serial killers. It's grounded in the rational logic of the medical model of mental illness and assumes that such aberrant behaviour is the result of a diseased brain. And Helen Morrison focuses on the brain, not the mind, the physical brain. She's actually married to a neurosurgeon, a brain surgeon, so you can see where she's coming from. Perpetrators who are deemed to be sane by forensic psychiatrists are usually deemed fit to stand trial and can face the death penalty in some US states. Those who are diagnosed as insane are usually confined for life. Now, there's no other method of investigation that is used or under consideration for investigating these motivations, or any other state of mind considered other than A, sanity with guilty intent, or insanity. So is that the only method of investigation? I argue not. And I go back to my mentor, Frederick Myers, who suggests very, very strongly that the research into psychic phenomena and spiritual phenomena is through the subliminal mind. And that's the route that I take. Now, Myers' experimental method offers an alternative strategy whereby the subliminal mind of the perpetrator is examined and investigated. This method bypasses the preconceived ideas and rational logic of the investigator, and it also bypasses the conscious awareness of the perpetrator. This method accesses hidden information that can be retrieved from the non-conscious awareness of the subject. Now, Helen Morrison attempted this just one time, and it's in her book. She writes about it. She consulted with a hypnotist, and she asked the hypnotist to work with this particular serial killer, whose name escapes me. But they tried it once, and it resulted in a traumatic regression experience for the perpetrator, and it had to be cut short. It freaked everybody out. The hypnotist, the investigator, Helen Morrison, and the perpetrator were all seriously traumatised by this one event. So she never used it again. So she stuck to her own method, and using her rational logic arrived at the conclusion that serial killers have a diseased brain. Now, so let's use Myers' method and look at the case of Jason Dalton. On the night of February the 20th, 2016, 6 people were killed and 2 others injured in a series of apparently random shootings that took place in an apartment complex outside a restaurant and a car dealership in Kalamazoo County, Michigan. Police detained a 45-year-old taxi driver, Jason Brian Dalton, as a strong suspect in the shootings, who was subsequently charged with the crime. After his arrest, Dalton confessed to committing the alleged offence. However, he blamed his actions on his Uber mobile app, claiming that its symbol resembled that of the Order of the Eastern Star, and that it took over his body during the events after he pressed the button of a new app representing the devil, when it abruptly popped up. Police indicated that he had no known criminal history or mental health record. But was his explanation believable to the rational mind? Of course not. So let's investigate using the subliminal mind. A soul rescue and spirit release group of 7 participants sat in a remote location from the accused with the intention of investigating by trance-induced remote viewing methods the spirit influence, if any, that may have contributed to the perpetrator's actions. The investigation took place as the accused man waited in jail for his trial. The following video recording focuses on the 2 key members of the circle. There were 7 in the circle, and you'll see 2 members of the circle. I'm the facilitator, and you'll see me working with a medium. The facilitator and the principal medium, the scanner who uses his clairvoyant abilities in a form of astral projection to scan the subject from a distance. Now, when working remotely in this way, various methods are used in order to retrieve information. Information can be given to the medium telepathically by spirit guides. So he's acting in the true sense of a medium. He's the third party conveying information, and he will speak it using the third person, or the spirit guide says, or he says. Or he can volunteer to allow himself to be used as a trance medium, inviting the possession of the spirit. And the key indicator that the medium is possessed by the spirit is when he speaks in the first person, as I. And here is an example. Does anyone know the name of this man?
Jacob, right?
No, we're talking about the following.
I believe it's Jason Wilbur, but I'm not 100%.
Well, I checked it out. There's plenty of stuff already been posted. His name is Jason Dalton, and he's becoming known as the Kalamazoo Killer. And he is 45 years old, married with 2 children. Okay. So that's what this case is about. It's an exercise to see whether we can detect that he has anything that's influenced his behaviour. Whether we can do anything constructive with it with the authorities is another story, but it's going to be a good exercise in how we do our work. What I'd like you to do now, Shoka, is wear your cloak of invisibility. Allow our guides to take a part of your consciousness, guide a part of your consciousness to Jason Dalton. Approach carefully and discreetly. And let me know what you find. Just give me your impressions on your initial contact.
So right now I'm just inside of the cell that he's staying in. He is kind of like this.
Mm-hmm.
And I can already see one entity without scanning him. It's very close.
Okay. Is it within his energy field, or is it apart from him? Is it attached, or is it shadowing? How would you describe the relationship between this entity and Jason?
Kind of right next to him, but in the same space.
Okay. Would it be helpful for us to engage this entity in dialogue?
It's not helpful for removing the entity, but it could be helpful for learning purposes.
Do you have a name?
Call me Steve.
Call you Steve. Okay. That's a human name. Have you ever had a human life?
Yes.
You have. Okay, Steve, thank you. And when did you live a human life?
700 lifetimes ago.
700 lifetimes ago. Have you been around the earth all the time since then?
In various forms.
So you come and go. Do you come and go at your own volition, or do you respond to directions from someone else?
Both.
Both. So you have free will and you follow directions.
I choose to follow directions.
You choose to follow directions. Okay, fine. So you are in the close proximity of a man that we call Jason. Can I ask you why you are close to him? Do you have an objective that we would understand? You really like to kill. Okay. But you're spirit, aren't you? You're spirit. Are you able to kill yourself? You are able to kill. But isn't it necessary for you to exercise your desire to kill through another person to carry out the act for you? Or are you able to do it yourself?
It's Sometimes I can do it myself.
So how do you do it yourself without the use of another person? How would you do that?
I just come in.
You just come in. A shadow. Okay. So each time you come into this world as a shadow, you are able to cause death by killing, just by using your own energy.
It takes a lot.
Takes a lot.
Can't do it.
Okay. Well, it'd be interesting to learn how you do it because you're non-material. So how does a non-material being kill another human? How do you do that? You obviously have great power, and you're obviously very, very proud of the fact that you can exercise this power and demonstrate your power by killing people and getting enjoyment from it. But I'm really interested to know how you do it. You get tired of questions, okay. So, I suppose we'd better end the conversation, hadn't we? Edited down to 6 minutes from a 26-minute conversation. But I just, because of the restraints on our time here, I couldn't show you the whole thing. But any of you who do want to see the whole conversation, let me know and I'll email you the link, because that is not for public viewing, okay? You need special link to view the whole thing. And you can see from there, on this site, there are many, many cases that I've recorded. There are 50 video clips altogether of different cases of different quality. So those of you who are interested, do email me and I'll give you the necessary links. So any questions at all on what you've seen there?
Is this not an American case, Kalamazoo? Isn't that
Yes, it's in
the United
Kalamazoo.
States? Why did you pick an American case and not the British one?
Because I was there at the time,
Well, you were there at the time.
yeah. And it was a case that was presented to me whilst I was there. There were two cases presented to me with this particular scenario where a person is hearing voices or being influenced by a discarnate entity. The other case was the case of a young man who was brought to me by his father. The father was really, really worried about the young man hearing voices and his behaviour. He was difficult to approach. He had been under psychiatric care for some time. So the father brought him to see me, and we sat down with the Soul Rescue group. I recorded a conversation with the young man, an audio recording, and asked him for permission to engage with the voices he was hearing, and he refused. So I said, well, would you like us to do this in your absence, remotely? And he said yes, he gave his permission. The father took him home, and then after a couple of days we sat down with the group and accessed the young man, removed those entities that were trying to influence his behaviour, and then I recontacted the family and asked how he was, and he was fine. And he no longer needs psychiatric care, and the whole family can now live in peace with the knowledge that the influence has been removed. So just two examples, two cases that were presented to me whilst I just happened to be in the United States. Any other questions?
Could you give us a little bit more detail about who the spirit guide is, please, and how he talks through the man that you were speaking to?
I've posted several video clips on the YouTube to answer that question, because it does vary. It depends who the medium is. With a Soul Rescue group of 6 or 7 people, the procedure I use is to call upon the help and guidance of each guide for each member in the group. And whichever guide has the knowledge and the power to deal with that particular case will come forward. So it varies.
Thanks.
Does that answer your question?
It does in this context, but we could speak afterwards, please.
It's a big field, isn't it? I mean, you're probably thinking of all sorts of questions that you could possibly ask. The reason I'm presenting this to you now, and I'm presenting it at 2 more conferences this month, one in Reading and one in Helsinki, with the same message. And the message is this, it's a very simple one. I'm looking for a scientific institution, be it a research institute, a university, a medical school, a psychiatric clinic, any kind of research institution that has access to people who hear voices, to collaborate with me on clinical trials to test this hypothesis under controlled conditions. That's my open invitation. So any of you here who are serious researchers and who have an interest in this particular avenue of scientific research, please let me know. And the full protocol, the research protocol, is chapter 15 of the book that I know many of you have. I think there are a couple of copies still left if anybody wants a copy. When all those copies have gone, there's a leaflet on the desk there where you can order it online, 20% discount. But it is not for popular reading, it is for serious scientific researchers. So that is my message. Erlinda.
Another question. I didn't hear all of your talk. How frequent is it among serial killers that they claim to have been obsessed in some way?
That's a good question. I don't know the answer to that, but it's a good question that needs to be investigated.
I remember we only have one case of a serial case in Iceland that was in the 17th or 18th century, and when he was caught, he claimed that he felt sort of a compulsion and he felt like possessed when he was killing his people. These were people who had spent a night in a rather remote farm. They were on their way somewhere else, and he would then accompany them a bit away from the farm the next day, and then he would kill them, and then in the end it was found. It was discovered that by that time he had killed quite a number of people.
It is an interesting question, what proportion of killers hear voices and act upon them. And reading Helen Morrison's book is a good insight into this, because she's looking at it purely from the diseased brain perspective and considers no other hypotheses. But when you read the transcripts from her interviews with these killers, it just stares you in the face. And this original paper that I presented at Bangor in 2008 gives excerpts from the transcripts of her interviews with these killers, where it's obvious to me what they're hearing and what's going on, and what these voices are saying to them. It should not be ignored, it should be investigated. Bernard.
I'm just interested in the legal status of the claim that someone is possessed, because obviously in these cases they first decide whether it's a case of murder or insanity. So does the court regard the claim of possession as a sort of subclass of insanity, and in which case it's presumably more temporary? I mean, because people who are possessed like this is often, am I right in saying, more or less a one-off as opposed to a sort of chronic, long-term form of insanity. So what's the legal status?
Well, I've tried to find answers to this question myself, talking to lawyers, and I've been in touch with a senior a very, very senior lawyer in the United States Supreme Court in Chicago and asked him this question. And his reaction to that was, this is an extremely difficult area to step into. And it's a question that he considers most people would be afraid to ask because of the repercussions if it were seen to be a valid hypothesis. How would the legal profession deal with that? So it's Michael Potts is raising his hand. Perhaps he has an answer for us there.
U.S. legal standard for insanity plea is that if you know right from wrong, you're not going to win an insanity plea. So if you try to make an attempt to escape, to hide what you did, it doesn't matter what condition you had. You might have mental illness, but you're not. You can't win insanity unless they can prove that you didn't know right from wrong when you did your deed.
Michael Whiteman examined two cases specifically to look at what happens in the courts. Two girls who were both accused of murder, and he found that there was total incomprehension amongst the whole court. So it was a very difficult thing, especially as he was not qualified to intrude into this case. But it's quite a lot of good reading, if I may say so, which I summarised in my book on Michael Whiteman.
But I mean, you can see the problem, because if ever the courts did accept that, I mean, everyone would automatically say for any crime, petty or large, I was possessed, and it would be very hard for anybody to assess that.
But the real value of this, for me, is that with education and knowledge and prior warning of the possibility, like the case of the young man who was brought to me by his father, I met this gentleman. I was travelling to the United States, and this chap sat next to me on the aircraft and just started talking to me about his son. And I said, well, I'm going to be working in Michigan for a couple of weeks, bring your son to see me. So, and we were able to prevent a disaster from happening with prior knowledge. And this is what's important to me. If we can gather the evidence that this is a reality and present the findings as a reality to educate people, so that we can say to them, if you have a family member who's reporting hearing voices and behaving strangely and starts going out buying guns, you know, this is a precursor to something disastrous that's going to happen. But if nobody believes it's possible that they could be influenced by demonic forces, then no one's going to do anything about it. So I see this as a pioneering research project to help pave the way to educate people about these principles. You wanted to say something?
Yeah, just that the legal system can get itself into tangles, because from a psychological point of view, nobody's responsible for anything. It's all due to biology and environment. But there are areas where it's really brought to a point. Diagnosis, multiple personality, or what it's called now is identity dissociation disorder. There have been cases where it has really become so sort of controversial. It's almost impossible to decide whether it's genuine or not. It's still a very controversial area, but Hillside Strangler, Stephen Bianchi, they had psychiatrists, psychologists saying it's genuine, others saying it's not. I think the final opinion was that it was some kind of an enactment, it was an act that he put on. But he blamed it due to some kind of, he blamed it to his multiple personality. There have been other cases. I think one of the most famous ones, he had 45 different personalities, but he didn't actually murder, he just raped lots of women, but he was freed, given psychiatric treatment. I'm not an expert on all these cases, but there are areas where it's really sort of impossible to decide, responsibility of the, as you say, whether the person is in a sound mind and able to make decisions. And other cases, another diagnosis is sleep disorder. If people, well, it's quite common for people obviously to have sleep paralysis, but people can also sleepwalk, and violence during sleepwalking is not sort of unheard of. There are, I think, about 40 cases where people have attacked somebody during sleepwalking, and then it becomes a legal issue. Was the person responsible or not? Perhaps that's a little bit easier if the person has a medical record and they can prove that they've had disturbance. But there are cases that hasn't helped, and the person has been sentenced to prison for murder because of it becomes difficult to decide whether the person is responsible or not, despite the fact they have done it in their sleep. So it's not that clear.
It's not that clear at all. It's a very complicated area, very, very complex, and there are all kinds of psychological theories and psychiatric theories to explain human behaviour. The theory that people can be influenced by spirit is still not within the realms of scientific inquiry, and I'd like to bring it within the realm of scientific inquiry. The method you're using with pagan healing, I think, is a very, very good protocol, good methodology, and I would like to talk to Chris about future collaboration in applying this methodology to people who hear voices. Does it work? Do they still hear voices after the intervention? It's a simple protocol, really. And there, ladies and gentlemen, I'm going to leave the question open. Thank you.
Because I think one thing is about crimes, but many people hear voices.
Yes.
And I think it should be taken seriously also in other areas, like with psychiatric patients. And I say this because I read a very interesting autobiography by a very clairvoyant Norwegian woman, and she voluntarily went into a psychiatric clinic to help with her grief. But she discovered that the other patients were hearing voices. She could hear their voices. She could describe the persons with the voices, and that was confirmed a couple of times with the patients. So she questions the concept of normality in our society, because we don't recognize voices. We misdiagnose people. So many people could be treated by therapists who can communicate with the entities and release them from the person, so the person gets rid of these entities. And this lady has succeeded in some extreme cases in Norway. This is just one example, but it's very worthwhile to continue to treat these voices they hear as if they are real, because they may be real, they are real. And that will change the therapy, and will change the concept of what is normal. These people consider themselves sick because society considers them sick when they hear voices. If they thought they could be helped, they would have a different view on themselves. Their self-confidence would change, self-respect would change. So I think it's worthwhile. I think we should investigate this area as in a new way. How can we help people who hear voices? And lots of people who are misdiagnosed just because they have voices.
And the first question to raise is this the result of the scanner's overactive imagination? Because it is quite an impressive interaction. The whole dialogue took about 25 minutes, but I've edited it down to about 5 minutes, so there are bits missing. But we can see from the video that the medium is possessed by a spirit. He's got all the mannerisms and body language of someone who is extremely confident and assertive and arrogant is the word I'm looking for, and he's only too happy to accommodate my stupid questions until he gets fed up with them, and that's where I edit the dialogue. So that's the first question. Is this the result of the scanner's overactive imagination? Well, the medium, his colleagues and friends immediately responded by saying that's not possible because he just isn't that creative. And that raised a huge laugh amongst his colleagues. He's just not, he just couldn't make it up. So how can we distinguish the difference between imagination and veridical authenticity? Simply by pragmatism. Does it work? You have the presenting behaviour. This man hears voices, command hallucinations. You intervene, you remove the cause of the voice, and you go back to the subject and say, are you still hearing voices? And of course, for a prisoner who's locked up in a cell, it's a bit difficult to do that unless you have the cooperation of the prison authorities that allow you to go in and interview, as Helen Morrison has that permission. So this is something that we're working on, trying to work with prison authorities to get permission to interview people. So that is the real test of the efficacy of the method. Does it work? Can the scientific research into remote viewing, there's a lot of it about since the US Department of Defense made it, and people working on the projects have made it so public, and we've had speakers at these conferences talk about remote viewing, is very, very similar. What the medium does is very similar to what the remote viewer does. And the scientific evidence for astral projection, bilocation, clairvoyance and telepathy add credibility to the phenomenon. Now, whilst the scientists, parapsychologists and philosophers are debating these issues, on the ground, at the coalface, so to speak, this is what's happening on a daily basis. Myself and my colleagues, David Furlong is here as a colleague, we're on a daily basis working in this arena, and it's my job to present the scientific evidence. Now, here's a selection of healthcare professionals who have documented their successful application of SRT in clinical practice. Carl Whitland, 30 years amongst the dead. I'm presenting these. This is not a full list, but this is a chronological. 1924, Carl Whitland, 30 years amongst the dead. Then we have Adam Crabtree, the Canadian psychologist, multiple man, 1985. Then we come to Edith Fiore, who wrote about the unquiet dead, the earthbound spirits of the deceased that attach to people. She wrote about that in 1987. Still working as a therapist in the United States. Irene Hickman, deceased now. I couldn't find a cover picture in English for her, but this is the Spanish translation of her work, Remote Depossession, 1994. William Baldwin, well known amongst spirit release practitioners. This is the manual that he wrote to guide practitioners. Shakuntala Modi, United States psychotherapist, still working in the state of Virginia, I think she is. Louise Island Frey, Freeing the Captives, again, earthbound spirits attached to people, 1999. And the most recent, I met this man on my visit to the States, Dr. Charles Tremont. He's a retired obstetrics surgeon. Worked for 32 years as an obstetrician, and towards the end of his career discovered the usefulness of hypnosis in helping his patients give pain-free birth. And having discovered the power of hypnosis, he took it a stage further, thank you John, and attended a lecture given by Raymond Moody, Professor Raymond Moody at the University of Nevada, who was teaching about past lives. And Charles Tremont asked Professor Moody, "Come, I invite the students on your course to experiment." And they embarked upon an experimental protocol where they investigated the past lives of volunteer students. And this is Charles Tremont's book, From Birth to Rebirth, where he presents his account as a surgeon and what he's discovered about the usefulness of the altered state of consciousness. Now, all these are medically trained practitioners and psychiatrists in the US or Canada. Charles Tremont now is teaching his colleagues, his peers, his fellow doctors about these principles, not by giving lectures, but inviting them to experience past lives of themselves. So, and I mentioned him because I think it's essential reading for modern medical practitioners with a serious interest in these techniques. Spiritism and mental health. Emma Bragdon has concisely put it all together from her research into how the Spiritists approach these problems in South America. The Spiritists have incorporated these techniques into institutionalized medicine since the 1930s. And she runs visits to South America. In fact, I think she's there now with a group of people, taking them around the psychiatric clinics in Brazil, showing them how these techniques work. So the Brazilians paved the way. They've conducted something like 49 clinical trials on this principle. And how many have we conducted? So these are my questions. What could be the benefits and objections to a research project to test this hypothesis? I would expect an answer to that question now. Under what experimental conditions could the remote spirit release method be scientifically validated? Would it be possible to interview perpetrators imprisoned? It's an objective. And here's the big question for me. Which scientific institution would be willing to follow this through in this country? And who would fund such an experiment? Big questions. Now, the original paper that I wrote in 2008 is accessible in PDF format through my website. And the final chapter of the book is a detailed research protocol for those of you who have a copy. I think there are 1 or 2 copies still left. Must reserve one for Erlander, who wants one. And that is the end of my presentation. Thank you very much. Any pragmatic suggestions?
Actually, I have a question. This case which you examined, did the person stop having hallucinations or voices?
The problem with that case is that we never got access to him in jail to find out. But I wanted to show that as an example of what it looks like when a person is possessed by it. Yes.
Thank you very much for that presentation in an extremely difficult area. But I'd just like to make 2 points. The first is, I don't think that Myers himself was a major experimentalist. He used the work of other people. And I really think you ought to reframe some of your material as Myers' philosophical work, which then led to a lot of other people making practical experiments. He did a certain amount, but essentially his was a literary-based pursuit. The second point I'd like to make was that in this hugely complex and difficult area, quality criteria, I think, are absolutely vital, because there are so many examples of self-deception, role-playing, the creative imagination of the subconscious mind that can leave even quite sophisticated people uncertain as to the true source of the phenomena. So those are just my 2 points. In terms of when you cite the original work of Myers, the theoretic element, I think, is more significant from his perspective than the practical one. And the second point is criteria, which are as objective as possible.
I would agree with that. Thank you very much for your comments. Thank you.
Yeah, is this on? Yeah. I just would like to make a point. I don't think the choices between a reductionist, out-of-date medical model and a spirit possession model. There's a whole area of forensic psychology which is based on the idea that we are not born equal, that some people have a temperament that makes them more vulnerable. There is also early brain damage, which people at risk. And then that in combination with a series of developmental factors like child abuse, sexual abuse, all of these can lead to a final common pathway. There isn't a simple explanation to why people become serial murderers. Every serial murderer has his own sort of biography, but it's often a combination of factors. So that is an alternative model. There are scales, Hicks psychopathy scale, you may know. So there is an alternative way of looking at it. I'm not trying to put down this. I think it's
I agree with
innovative, interesting, but don't underestimate the difficulties. Any medical practitioner in Sweden who tried this would lose their license straight away.